matter to our health. Good physical and mental health depend on having homes that are safe and free from physical hazard. When adequate housing protects individual and family from harm, exposure, and provide them with a sense of privacy, security, stability, and control, it can make a very great contribution to their health. Stability is one of the main things that housing can create in support of health. In contrast, poor quality and inadequate housing contribute to health problems such as infection, chronic disease, injuries, and poor childhood development. We have several issues in several properties that we work with in the past that are critical, especially when we go from lead paint. And I don't know if you know, also we have issues with infestations of rats and other elements that create a very serious crisis in family. The exposure infestation and the temperature in the housing created physical and emotional problems. A home with structural damage creating insecurity to the residents. A overcrowded and certain affects the psychological, environmental, and emotional of the individual of the houses. At my organization, Casa, the organization that I run, we are committed to ensure that when we renovate a tenant-occupied building or develop a new construction or managing a rental property, our priority is focus on housing stability and all on the well-being of the tenants. So it's important for us to make sure that when we take control of a house or a building, the first thing that we look at when we're going to do renovation or analysis of the property is that we stabilize the property to secure that the stability of the housing represents stability of the tenants, and the stability of the tenants represent income to us. That's the reality. So we can secure the function of the property properly. Our panel today will examine also those elements, those strategies, I believe, and the strategy of their organization are using to address the needs of their clients. There will be a presentation of 3 or 5 minutes with each of you on the work that you do. This will be followed by several questions that I have in my list of questions that I want you to answer because I want to learn. and it's in the process of learning as well for me. And then after that, we will open the audience questions. And I think there will be interesting questions from the audience, and it helps that we all learn from this experience. So, ma'am, can you start?
Good afternoon. It's my honor to be here as a staff person with the U.S. Department of HUD. I've been with them for 7 years, but I've also been in your shoes as a community service provider. So I'm assuming some of your housing authorities, federally qualified health centers, yes, anybody from the housing authority? Advocacy groups? Who do you represent? Foundations, okay. Free clinics, excellent. So I've been at this for a long time. So I've worked for a federally qualified health center, worked for United Way, the Urban League, and the Housing Authority, and now I'm at HUD. And I'm bringing all of that customer service insight to the policy, the programs, and our funding priorities. So I appreciate the fact that you're here to hear about what we do in our walks of life, but we're also hoping that we can hear about your challenges and your successes so that we can help to uplift those or to resolve those. And if you're facing housing and health-related challenges. So I am a staff person with the Choice Neighborhoods Initiative. It is a 6-year initiative that started in 2010. It is the newest revitalization program. What that means is we tear down dilapidated, dysfunctional housing and build back new, healthy, green housing in the footprint or around the neighborhood or even outside of the footprint. But it's more than a housing revitalization program. I'm a social worker, so I'm not doing that much on the side of bricks and sticks, but on the social side, there's a people component and there's a neighborhood component. Because we learned in the last 20-some years that revitalizing housing was just not enough. You have to work in collaboration with the health departments and the state health departments and the local fairly qualified health centers and the hospitals. You have to work further with the education systems and with the juvenile justice system and the correction system and all of those that are providing basic subsistence in the community, as well as jobs, as well as recreation, as well as wellness programs, what's transportation. And so when you think of Choice Neighborhood, think of the revitalization of housing, neighborhood, and the lives of the people who reside not only in the targeted site, which may be public housing or a multi-family owned property, which is privately owned. So we learned too that you can't just revitalize your public housing units in the footprint. You've got to spread the resources to those other units that are also receiving a HUD subsidy. So Choice Neighborhood is our place-based initiative that is allowing us to revitalize over 1,000 units in some communities, and in other cases, it's 100 units. And so it just depends on how large the footprint is, how big the population is that's in that particular target area. It's a competitive grant, so not everyone gets one. We have about 70 planning grantees. So these are grants, cities and housing authorities, multifamily owners that have gone out, competed for planning money, $500,000 to create a transformation plan. What that means is they pull all their partners together. Usually 30 to 70 partners come together in the arena of housing, education, health, employment, recreation, economic development, and public safety. They come together to talk about how can we do it differently? How can we change the message that we're sending to our public about what's in their best interest? How can we engage our public so they can inform our policies, programs, and outcomes? And as a result, those 60-some and now the newest 10 are developing transformation plans where they're improving educational outcomes, health outcomes, housing stability, employment, as well as adding transportation and those other items that I itemized. We have over 20 grantees that have received implementation grants. They get $30 million. Now, that sounds like a lot of money into the foundation. You know that goes fast, right? That barely builds one phase of housing when you're talking about 1,000 units. And so they leverage an additional $6 to every one of our HUD dollars that goes in the pot. That comes from private investment, that comes from tax credit dollars, that comes from foundations often supporting the people side of our business. And that also leverages lots of in-kind resources from health organizations, education, employment organizations, workforce investment organizations. So at the end of their 5-year journey, they would have revitalized the housing. Residents would have improved their health outcomes, their educational outcomes. More folks would have jobs. Housing would be green and healthy. We would reduce those lead-based units that existed in our homes. Many of our residents have asthma, and so we know we're trying to green up the property as much as possible by removing carpet. Safety issues, not only in the homes, but also in the neighborhood by better lighting, better sidewalks. It's amazing how many people get ran over walking in streets in some of our neighborhoods, and so putting better transportation systems in is a priority. So Choice Neighborhoods is just one of the many things that we're doing at HUD, and as we go through this conversation, I'll look forward to uplifting what's happening in the youth arena as well as in other health arenas that we're involved in. Thank you.
Thank you. Abra.
Great, good afternoon. Also glad to be here. So I'm Abra Lyons-Warren. As Fernando said, I work at the Council of Large Public Housing Authorities. So we pronounce that acronym CLAFA. But for those of you who aren't familiar with the organization, we are a national nonprofit. We're based here in DC, and we're a member-based organization. So our membership is made up of about 70 housing authorities across the country. as the name suggests, they're the largest housing authorities. Places you would think of: DC, New York, Chicago, LA, Seattle, mostly urban, but some suburban. Only just a couple rural housing authorities are in our membership. We also, though, work with other housing authorities. There are thousands across the country, in case you didn't know. And then, as Pamela mentioned, there are also affordable housing providers, so we work with them as well. Most of the staff do general policy and advocacy work around preserving and increasing affordable housing in this country. I would say that we have a crisis. There is a large gap between the affordable housing that's available in the US and the need for that affordable housing. But I specifically work on leading our Housing Is initiative. So this is really exciting work. A lot of it is really similar to what Pamela was just describing, but it's this idea that housing is a foundation. And so through that, housing then becomes education, it becomes health, it's transportation, it's workforce development. So, also as Fernando was mentioning in his intro, when we have that stability, we're really able to accomplish all of these other goals and outcomes that we hope for and try to achieve for low-income individuals and families. And I don't know if there's anyone in here who also maybe focuses more specifically on homeless populations, but that touches that as well. So all of the different areas that Pamela was laying out, all of that goes in, right? So all of these different systems we have, we already mentioned education and health intersecting with housing, but it's the criminal justice system, it's transportation, it's workforce development. So again, we all, I think, want to achieve the same goal. We want it to be that, if we look at children who are being served now, who are residents in affordable housing units, we want it to be that in 10 or 20 years, they don't then need assistance themselves. So, we really want to create these partnerships and align these systems better so that we can all be more effective and more cost efficient. We like to say that, when we're talking about the intersection of housing and health, we like to say that housing is a prescription. So that's our go-to health and housing phrase that we like to use. But I probably don't need to tell anyone in this room that we know low-income and homeless individuals interact with all of these different areas. They really, throughout a day, I think this population in particular, just so creative, so resourceful, but because they're interacting in so many different places, how much more effective could we be if we're all talking to each other? So, as I said, I spend a lot of my time creating partnerships where they don't already exist, strengthening them where they do, and this really comes out in a wide variety of ways. So it could be between a housing authority and an entire school district, it might be a single community organization, it could be a health clinic, it could be an entire hospital, it could be an entire Department of Public Health. So really, ranges from that very hyper-local to state-led to national initiatives. We do a lot of work with mayors, we do a lot of work with the different federal agencies. We're working on an exciting bill right now with Senator Murray's office, which would provide funding to help support a lot of these partnerships. Stay tuned for that in January. Fingers crossed for a useful Congress. So I think a productive, yes, thank you. So yeah, I think it's really just about, we know that minorities are disproportionately making up these populations, and so what can we be doing to help those families be successful? So it's exciting to be here today to be talking about reducing these health inequities, particularly for Latino youth and families.
Thank you. Now, you can do it in Spanish.
I could. Hi, my name is Talia. I am a bilingual tenant organizer at the Latino Economic Development Center. Our organization's been around for about, actually 25 years. We, for about 18 years or so, maybe longer than that, were located in Morgan, so the community kind of knew where we were for a long time, and we've recently moved to Shaw while we're looking for another permanent place to have our office space. So our organization, obviously in the name, has a focus on the economic development in the Latino community. Our organization is kind of divided into two sides. One side sort of focused on small business development and lending, and then our other side is on housing. Obviously, we have a target sort of focus on the Latino community, but we do serve all types of people in the DC area, Maryland, and Virginia. On our housing side, we're sort of split into two sides. One side are housing counselors who assist families in becoming home buyers for the first time with credit counseling, information on inclusionary zoning units, things like that. And then the other side of our housing department is the side that I'm working with, the Affordable Housing Preservation Program. I've been with LADC for about 2 years, and in those 2 years I've learned a lot about difficulties that families face in DC and the uphill battle it is to improve conditions and keep your affordable housing. Our main work is in sort of two main areas. We organize tenants when their buildings go up for sale, and then we also organize tenants when they have bad conditions. Truthfully, pretty much every group of tenants that we work with are experiencing bad conditions. It's kind of just sort of a fact in DC that if you have relatively affordable housing, you also probably have bad living conditions. And so whether a tenants association's building is for sale or it's not, they tend to all have struggles with conditions. So I'll talk first sort of about the when your building is for sale thing, because that's sort of a right that a lot of people don't realize exists in DC. So DC is actually the only place in the country that has something called the Tenant Opportunity to Purchase Act. And it's an opportunity for residents in buildings. So we work primarily with 5 units or more, but there are opportunities for you to exercise this if you're in 4 units or less. But basically, when your building goes up for sale, your landlord has to issue an offer of sale, a copy of it to all the residents in the building. And that offer of sale explains to tenants that they have a certain amount of time to get themselves organized into what's called a tenant association. And they have a right that they can exercise under that law. And so they have a couple different options. When we help tenants organize, and there's a whole process that that's involved with that, but once they become organized as an association of tenants, they can basically choose and decide the fate of their building. So even if a building goes up for sale and the landlord has already decided who they want to sell it to, that sale is on pause when tenants decide they want to go through this exercise this right that they have, basically. And so they have a couple choices. They can have their building converted into a condo. We almost never see tenants choose that route because that's oftentimes a higher income option, and we work primarily with low income tenants. But they can also convert their building into a cooperative, which would mean that each resident in the building would be a partial owner of the building. They would have a share in the ownership of the building, and they would, and this is a great option, particularly for tenants who've continually had turnover of landlords and they've continued to have bad conditions, bad management companies, and they're tired of hoping that another company will come in and finally do a good job. So they can basically take all the power into their own hands, and they make decisions about management, they make decisions about rent increases, about all of those things. But that is an option that requires work, so whenever we're working with tenants, they have to really understand, you have to be willing to put in work to choose to go through the cooperative option. Because when there's an issue in your building, there's no landlord you call, you are the landlord, so you all have to figure out how to solve that problem together. But it is a great, very empowering choice that tenants have in DC. And then the other option is they can just choose who the next building owner will be. And the power with that is that they can try to say, they can say, well, we've had terrible management companies for a long time, we're living in horrendous conditions, so we are going to pick a landlord who's going to have a management company that's going to be responsible. We can do research to see what their record is in the city. We can pick a landlord who's mission-oriented, who has an interest in preserving low-income rents, or rents that are payable for low-income folks, and improving conditions, creating a safer environment, things like that. Sometimes that route can be difficult for tenants that are in smaller buildings because you oftentimes need a lawyer to represent you through this process, and lawyers oftentimes want to work with larger groups of tenants. Also, developers sometimes want to work with larger groups of tenants, but there are options, and we always encourage tenants to go through this process, and we tell them, we can't guarantee what the results are going to be. We can guarantee that things probably will not change if you choose to not go through this process. And then our other side is that we do just direct conditions work with tenants. So the building might not be for sale, but they're living in terrible conditions. They call their management company every week about the same problem, and the landlord or the management will either say, yes, we're coming, or they just won't respond at all, and basically the issue continues and continues and continues. or we'll see management companies that will deal with health issues in an improper way. Like for instance, some pipe is broken in the wall and there's this continuous leak, and the landlord will come in and like paint over a mold stain, and not because it's cheaper than fixing the root of the problem, which, you know, the mold's not gone for one because it's just painted over, and also it's going to keep getting wet from whatever broken pipe. So even though there's a lot of really strong tenant rights in DC, it's still an uphill battle to solve those issues, and tenants have to put in time, unfortunately. And so a lot of our work is helping tenants come up with strategies in order to solve these issues, and uniting together to solve them, to not try to solve them independently, to work as a team, because there's strength in numbers and there's power in groups. So that's sort of the main work that we do. And because we have to meet with tenants when they're off work, in order to organize them, we often have a later schedule. So the organizers at LEBC work from like 12 to 8, 12 to 9, so that we can meet with tenants around 6:37 in their apartment buildings to have discussions with them about strategies and plans when they're off work. So yeah, that's what we do.
Thanks.
It's a lot of things that you do.
It's a lot, yeah.
Casa is on the other side of the question, to be honest. Casa is a developer, and we work with Tenant, and we work with LADC specifically, and we do a lot. Before I go into my list of questions that I want to place, I have one. Most of the tenants that we work together, they are not bankables. They can't go to a bank and secure a mortgage. So that was one of the main issues that we're confronting when we organize it. And the reason that preferably we develop co-ops is because of the co-ops, they can acquire and they can own and they can control. They don't need to go to the bank as an individual. And that is one of the key elements in development. And I think it's the TOPA in the last 30 years mobilized and changed tremendously the area. And recently we have other areas like in Minnesota and Washington State. They start to look at the law, TOPA law, that we call it as a model that they want to implement it there. Now, going back to my list of questions, so each of you represent a particular approach to type of housing services, guide either by legislations, I'm sorry my English, found as a structure or from your perspective. What challenge do Latino immigrants face seeking housing and addressing housing providing issues? That's a question that I want. The question number 2 in that particular is, how does challenges differ if immigrants are undocumented? Here is the problem. I'm sorry, I put it out on the table. And third, in what way this issue or barrier affect the health of immigrants?
I can start with the first question.
Yes.
So we're supposed to have this really relaxed dialogue with you all, so try not to be too formal. Firstly, I think you heard I was saying that no matter who's in need of housing, there's not enough of it. And so the very first challenge is access to housing, whether you're in an urban, rural, or even a suburban community. There's just not enough. I stated earlier, I worked for a housing authority in Indianapolis. We had a 10-year waiting list for our Section 8 vouchers. They only opened up the opportunity to get on the list every 7 years. And it took 3 to 7 years just to work through the list because there were no new allocations of vouchers. And so when a voucher became available, it was because someone moved out or someone was evicted out or unfortunately someone passed away and the voucher now became available. So that's not a very fast process when someone is on the waiting list. So what I've done in my walk as a social worker trying to help people access housing is to truly help folk understand that there's more than public housing available. And I was saying earlier that I didn't even know until I went to work for HUD how many HUD-funded programs there really were, because we don't do a great job of marketing. There's not a commercial that says, if you're in need of housing, if you're a senior, here's the resources. If you're disabled, here's the resources. If you have HIV/AIDS, here's the resources. You find it through a health center, through a case management firm, or through the 211 number, or maybe a local church. But for the most part, there's no great marketing campaign to let you know the very diverse housing resources that are out there. And so I would encourage you all to go to HUD.gov and look up our housing inventory mapping system that is newly in place that allows you to go to a state, to a city, to a street to identify the subsidized housing providers, whether they're public housing, multifamily, whether they're non-for-profit, faith-based ran, whether they're a continuum of care provider for homeless, whether they're a special supportive housing provider for those who have mental health issues. There's the breadth of housing now provided online that you can access, get a phone number and address, and understand the occupancy requirements and get a name of person you can call. So now there is at least some vehicle for you to get the information. Doesn't change the fact that there's a long waiting list. So one, awareness of the programs. Two, access to, it's limited no matter what citizen you are. And so you have to know how to manage the system itself. So not only putting your application in, but understanding what documentation you need to bring with you to complete that process. And so for those who are newly in this country, don't speak the language, sometimes just getting an awareness and understanding of what's available and what to do to prepare for it is a big struggle, huge challenge. If you're undocumented, then it's even more difficult because you're afraid to ask, because you're afraid that you could potentially be arrested. But believe it or not, there are federal, state, local, non-for-profit, faith-based housing organizations that have different rules and regulations about whether or not they even ask for your social security number. And so you can be undocumented and live in public housing. Did you know that?
No, ma'am.
Okay, you can. Matter of fact, I was in Brownsville, Texas just last week. It's right on the border of Mexico, and they have 31% of their households have undocumented individuals that live in it. As long as one person is a legal resident, you can get a subsidized housing unit. But the amount of money that is paid will vary because of the number of undocumented individuals who live in that household. But it's a start, and then as they move toward getting documented, then they can then get more subsidy. That's public housing that they can be eligible for. There's state and there's local that sometimes don't even ask, won't need to ask about your immigration status or even security or social security number. The other thing that I think is a big challenge for Latino as well as those that are undocumented is the lack of awareness of the appeal process. Often people get denied access to housing. You might make referrals and they come back saying they denied me, all the world is over. It's not. You can actually appeal that process. You have to do it within 30 days. You have to do it in writing. You have to bring the additional documentation, and then a higher level decision maker will review your information and say, oh, you really do qualify. You know, you didn't fill this section out correctly, or we misunderstood, you know, the documentation that was provided, or maybe your documentation was incomplete, and now you can bring all that was required to get a second consideration. So please encourage all of your folk to appeal. And then the last and biggest challenge is lack of an address. And so if you're newly coming in, if you're living with someone and it's not a stable housing and you're moving from place to place, that if you get on that list, they call you and say, come on in and fill out your next level of application, but you're not there, you've moved. And so you have to make sure that you continue to keep a stable address so that communication can flow when the opportunity does present, whether you're documented or undocumented. Those are major challenges.
Yeah, so I think, you know, a lot of what Pamela said is a lot of what I would say too. I would add, for point of clarification, so public housing authorities in this country really administer two programs. So I think the first is probably what most of us think of, really that traditional housing stock. You might have a picture in your head of, you know, oh, like that looks like affordable housing. But they also administer what's known as the Section 8 voucher program. So for those of you who are unfamiliar, basically, again with the caveat, they're very long wait lists. If you get a voucher, in theory, I say in theory because that's my next important point, specifically for this population, you can go and rent housing anywhere in your geographic location. I say in theory because, of course, there's discriminatory practices that are illegal, but are extremely hard to regulate because they're private landlords. So when it's public housing stock, the landlord is the housing authority. But when it's Section 8 vouchers, those are private landlords in most cases. So it becomes very difficult to follow up it becomes difficult to keep track of. HUD doesn't have enough staff, other federal agencies don't have enough staff. And then when you have this extra element of folks who are undocumented, and as Pamela mentioned, there's that fear a lot of times of retaliatory practices, that's where that comes in. So there are a lot of great nonprofits across the country. I used to work for one in Chicago that works specifically with tenants who are undocumented to help them know their rights, educate them about that. But I think a lot of people, they're afraid of getting evicted. They're afraid to even ask to have something as basic as heat. So in Chicago, that's almost exclusively included in your rent. That should be mandatory with your lease if you're paying your rent. But you have a lot of slum landlords, essentially, who are doing these things, and they often get away with them because families and individuals are really scared to report anything because they're afraid that they're going to get deported. So that's a huge hurdle. I think there's even times when simply if English isn't your first language, tenants don't necessarily know how to go about communicating with landlords. But there's also, I think, a lot of perception and stereotypes that landlords have, and they might assume that someone is undocumented even if they're not. So I think really that's what I would echo Pamela in that there's a dearth of housing, but there's also a lot of awareness that needs to happen, both on the housing side but also on the tenant side. And maybe that's a good place to have you jump in on awareness. Yeah, sure.
So to the first question about what challenges do Latino immigrants face, so not all of them are specific to the Latino community, they're just kind of specific to low-income residents in general, but and Fernando spoke about this a little bit at the beginning, so we see people living with mold in their apartments for a very long time without getting it removed properly. Older buildings, which is typically where the lower rents are, still have lead paint on the walls, and that's particularly dangerous for children and for older adults. Safety issues, also, lower income buildings, landlords tend to spend less time and money making the property secure for folks, so that can be an issue. Abra, you touched on language, that communicating with your landlord can be difficult, or understanding what your landlord is trying to communicate to you can be difficult. We do also see overcrowding sometimes, and I do think that part of the issue is that there's not a lot of units available in DC with multiple bedrooms anymore. There's a lot more construction of smaller and smaller units. There was an article that came out, I think it was in Washington City paper, or maybe it was the Post, about this building called Brooklyn Manor. A lot of you nodding. It was a Post, where, an argument is being made that families are being discriminated against in this situation because they're redeveloping this property and they're saying all these low-income tenants can come back, but they're getting rid of these multi-unit apartments and making them 2 or 1 instead of 3 and 4, which is not a lot of units. You never find that really in DC where there's that many bedrooms in an apartment that also happens to be affordable. And so that's definitely an issue. And then in terms of the difference when immigrants are undocumented, fear has been touched on. I think also, and I think people in DC in general don't realize how many rights they have, but I think a lot of undocumented folks in particular don't think they have any tenant rights, and that isn't necessarily true. For instance, something that we see sometimes is a family will live in a unit and they'll be on the lease, and they'll have a friend of the family or another family that's friends with them or is related to them in some way who's trying to find housing, and they'll let them live with them. So then for a period of time the unit is overcrowded, and then at some point the family that's on the lease decides to move, and they'll let the family who they had stay with them, they'll say, just stay in our unit, in this unit. And so the tenants who are there, they might be undocumented, but they're also not on the lease, and they'll oftentimes continue to pay in the name of the person who was there before because they're trying to, they don't want to be found out that they're there. Something that a lot of people don't realize is that, and a lot of times, particularly in the buildings that we work in, landlords aren't paying a lot of attention to who is paying. They're just paying attention to if they're getting the money that they need for the unit. But if you were not on the lease, if you're undocumented, and you pay in your name and the landlord accepts your money, you automatically have tenant rights. So, and a lot of people don't realize that because they are trying to hide the fact that they're in the unit. So I'm not a lawyer, so I'm not suggesting that this is something that people should do, but a lot of times people don't realize that they have rights in those situations. I mean, it can be tricky to do that because you don't, also a lot of times residents don't want to be found out that they're there, so paying in their own name can be a dangerous choice to make. But sometimes people have done that and not realized that technically they actually have rights. The landlord accepted, the landlord can't claim they didn't know they were there because they've received, you know, money in their name, basically. So we try to educate tenants on that because I think that adds to the issue of fear, is that they also don't feel like they have any rights at all. And DC is, I mean, probably one of the better places to live as an undocumented person, that I don't think there's as much, I think that from what I understand is there's definitely less safe places to live in the United States as an undocumented individual. And then, so in terms of the question of what ways or ways these issues affect health, well, obviously, so these sort of conditions that people have to live in for long periods of time without being able to remediate them definitely are going to affect people's health long term. I think also stress is a big thing that we don't talk about a lot, in that even if you don't have necessarily, even if you have bad conditions but they're not necessarily affecting your health directly, like mold or lead paint or things like that, housing instability or fear that you're going to lose your home, and that constant sort of fear of that is, I mean, I'm not a doctor or anything, but I can't imagine the kind of stress that the buildup of that over time, and that never going away. On children who have to move around constantly, changing schools, things like that. I mean, I think I read somewhere that housing instability is like it's connected to everything else in your life. It affects every other aspect of your life. It makes everything else difficult. And so I think that's sort of probably the silent sort of health issue that low-income people, Latinos, anyone who's a low-income person has to deal with. Because, and this is the thing that I confront as an organizer a lot, is that I'm asking people to do something that sometimes is scary in order to fight back against people that are forcing them to live in these terrible conditions. And that can mean even more stress. You know, I mean, we educate tenants on what their rights are, and we are letting them know that, you know, these things that you're doing, you're in your right to challenge. It's your right to challenge these things. It's your right to have safe, sanitary housing. So you have a right to speak out about it. You have a right to try to improve your conditions. But the amount of things that tenants have to do in order to improve things, you know, they have to go to court. They have to have late night meetings. Sometimes they have to take off work for things like court and things in order to improve their conditions. So all these things, you know, affect people's stress levels, absolutely.
Yeah, and I'll actually just add to that. Thank you for bringing that up, Talia. I don't know if there are any researchers in the room, but toxic stressors is the term that a lot of researchers use, and there has been definitive conclusions in the field about the long-term and short-term effects that has on people.
Yeah, before I move forward,
But don't move just yet, Fernando, if I may. Because I travel a lot with HUD, I see even some of our public housing sites that have been built on top of landfills in very toxic soil. I mean, I've got 3 communities right now where we're trying to get residents moved out, because if they disrupt the soil, then they're now at risk. And these are fairly large, 400, 500 unit communities in urban environments. And so when you can't rent from an entity like a public housing or a multifamily unit that's receiving subsidized income, that means they may not be getting the regular inspections that need to happen in order to keep their public money flowing. And so undocumented folk tend to move into very dilapidated, substandard housing that may be in a Brownsville, that may be in a place where the property is not even defensible. There's no lighting, there's no sidewalks, there's mold, there's other toxic things happening within those buildings. And so I think the health risk enhances further. And because they're in those neighborhoods, they also have their children going to schools, sometimes that are also very old and not always the healthiest environment. And I know that our folk from the CDC and the Environmental Protection Agency are really working to try to help schools enhance the health situation within their environments as well, but they're getting faced with unhealthy living environment, unhealthy school environment, unhealthy walk to school, unhealthy food in their neighborhood, and so you have this huge roller coaster ride of negative impacts on the lives of those who don't have money and can't be financially, cannot get to good quality housing because of their undocumented status.
One of the things that's very important what we're talking about, but gentrification is one of the big enemies for us. Their landlords open the doors, especially, let's say, before gentrification, to immigrants or any kind, a very dilapidated building in bad condition, open the door to the immigrants to a minimum cost. When gentrification starts to move, not only they increase the cost, they threaten them to call immigrations, or to call this, or do that to them. So create a system of insecurity for them to move out of the unit that they occupy. In many cases, for many years until gentrification. The other things that they created this situation, and we find, I don't know, then, at least in the Casa situation, we find that the instability in the family created a lot of abuse among themselves, husband and wife, or partners, or whatever. Also, the situation that they confront is we've seen more and more alcohol and drugs in the family. Especially, is by surprise, we typically would say, okay, alcohol is a male, it's more typical we see in the Latin women's and the immigrant women's that confront the issue. Start to grow alcoholism in the family. So with that is, my question to you again is, what strategy your organization implement to help those immigrants to overcome these situations? How we work together to overcome the barriers? What kind of communication? Maybe you want to be first, etc.
Sure. So I probably can't list all the different things that different options that tenants have, but I'll try to mention some of the ones that I think might be most interesting. So one of the, as I said before at the beginning, that all the buildings that we work with have substandard housing conditions. Tenants whose buildings go for sale, while in the beginning that can be a very scary thing for tenants, they don't understand what the offer of sale means, they're confused about what it means for their owner, the ownership to turn over. They oftentimes, when I first meet them, will say, so when do we have to move out? Which I'll say, no, regardless of a change in ownership, you don't have to go anywhere. You still have tenant rights, you have a lease, so you don't have to go anywhere. But one of the great things that can happen through the TOPA process, when I say TOPA, I'm referring to the law that allows tenants to choose what happens to their building, is that they can, if they decide to choose a different developer, and as Fernando had said, his organization, Mi Casa, is one of the organizations we will suggest to tenants as an option for a new ownership or help converting to a cooperative. Mi Casa has sometimes done what's called the LIHTC program with low-income buildings. It stands for the Low-Income Housing Tax Credit Program, and through my knowledge of my work, and they might have other ideas, but for me that's kind of been the best way for low-income tenants to get a completely renovated building. There aren't a lot of other ways I can think of for that to happen. And because it's a program where there's a benefit to the landlord and they get tax breaks, but they are able to, and through that program they are supposed to be only doing this for low-income tenants and doing a substantial renovation of the building. So not just code compliance, but extra stuff, and making the building green, certified green, energy efficient. This is the best way for them to get rid of that lead paint that's on the walls. And so, just as an example, there's a tenant that I've worked with, I won't use her name, but she, for many years, was really frustrated about her housing because she had a child who had asthma, and there was also lead paint on the walls, all these other things that her child was breathing in, and she was constantly at the hospital trying to get these things dealt with. And she even had a note from the doctor saying this child can't live in this unit like this anymore. But she didn't have any really other options to move out because the rent she was paying was still a lot for her, but she wasn't going to find anything comparable in the neighborhood and in such a great neighborhood where she was living. So their building went up for sale, and they were able to find a developer that wanted to do LIHTC, that wanted to do the Low-Income Housing Tax Credit Program, and she lives in a completely renovated unit now, and she didn't have to move her children to another neighborhood. And yeah, it's great. I mean, she's obviously her child still has asthma, still has health issues, but the issue of the housing being part of the problem is not a problem anymore. So lots of other things we suggest to tenants and when their conditions are bad. I mean, you can go to conditions court. That's something that exists in DC, where you can basically sue the landlord for failing to keep the unit up to code. Again, this is an option that requires time. So, for families that have multiple jobs, or a single parent, and they might not be a lot of time for this, but it's an option. Children's Law Center does a lot of work with families in particular with housing issues related to health. So particularly if there's a family that has children and there's some sort of health issue in the unit, we will direct them to them sometimes. There are a lot of things that tenants can do on their own as a group to improve conditions. Sometimes they have to get media attention on their building. A lot of you nodded when I mentioned Brooklyn Manor. People knowing about what's going on and other people who are not directly affected being upset about it really helps, because you have people will call in and we'll organize situations where we'll have a bunch of people call landlord and say, we've heard about what's going on here. This isn't right. And landlords, slumlords in particular, it's a business and they don't want people to know that they're doing a bad job. And so sometimes that will encourage landlords to do the right thing. If not for the human reason, but for the financial reason. But it still happens, and we want tenants to live in good conditions, regardless of how they get there. Sometimes we'll have tenants organize actions. So one of the things there's a building that we work with on 11th Street that's been in a multi-year sort of battle to improve their conditions. Just to give you an example of how bad the conditions are, they had an enormous rat infestation in their building, and when I say rats, I mean rats, not mice, like rats, the big ones. And the tenants had they'd broken, it's just survival skills here. They broken a lot of the brooms in the building and sharpened them to kill the rats, because that's how many there were. And at one point their landlord issued a hardship petition, which is, it's kind of complicated, but there's a lot of different petitions that landlords can file in order to take substantial rent increases on tenants. And a hardship petition means, I'm a landlord that doesn't make enough money, I need more money, and so I need to raise tenants' rent so that I have more money. And so we organize tenants to say, we're going to continue to pay our rent, but we're not going to pay that increase, because the DC law says that you have to keep this building up to code before you increase my rent. So you can't ignore all the times we've called you about these issues and keep raising our rent. So they did every month they would all go together as a group and pay their rent at the office as a united group, saying, look, it's not because we don't have the money, it's because you're forcing us to live this way. And they would pay their rent together, but they would only pay what their rent was before the increase. And they're still fighting. Things are, they got a lot of media attention, so things are getting better there. But those are the kind of things that we'll try to encourage tenants to do to show their landlord that because a lot of landlords, they think that the tenants are afraid and they think they can do whatever. They can break the law, and it's much more work on the tenant side to get that issue resolved. So we like to have tenants do these sort of shows of, we're united, we're not afraid. There's also one other thing. There's also the Department of Consumer and Regulatory Affairs. They do housing code inspections. So we encourage tenants to try that as a step in the process of getting something from the government that says, the conditions are bad here. And the point of that process is that after several inspections, DCRA is supposed to issue a fines to the landlord saying, okay, you were supposed to fix these within a certain amount of time, now you're getting fined. We're kind of finding that the fine sort of disappears, so we're sort of trying to figure out what's going on with that. But it is a good step in the process to be able to say, at least we tried this, and there is documented proof from a government inspector that conditions are substandard. So.
Great. So I think what might be useful, since those were fantastic ideas from the tenant side of things. Some of the things that we focus on the houser side of things, again, partnering with agencies, coming in to do presentations to residents about their rights and a whole host of other topics, a lot around health, a lot around education. But I think one thing that we've really encouraged a lot of housing authorities to do, and that they've been doing on their own as well, is to really make sure that their staff is culturally competent. So, probably most of you in the room know that term, but particularly where there are populations where maybe it's majority Latino or another large population making sure that the staff, you have enough staff that speak Spanish or other resources to bring in other languages, and really addressing differences in cultural norms and how that might deal with other things. So I think Pamela used the term sticks and bricks earlier, which in the housing world, yeah, I mean, that's when I say, you know, when you think of traditional public housing stock, it's that image of these buildings, some of them in large amounts of disrepair. But really, I think for a very, very long time, public housing's original purpose was just to house. And you know, as I think everyone on the panel has made the point, we do know from research that stable housing is that critical first step. But then that idea that, you know, we can wrap services around people, sort of that housing first model, if there are case managers in the room who are familiar with that term, I think has really become more widely accepted in the field, which is fantastic. So we're really seeing housing authorities saying, you know, we want to do more to help get our residents better connected to health services. You know, we have more and more seniors aging in place. We have, you know, children and youth suffering from asthma, and they're missing school because of it. So really making sure then that in terms of the preventative healthcare side as well, we have staff that are saying, you know, we know how to work with residents. You know, maybe in Fresno, California, for instance, I know this is a regional conference, but they, a lot of their residents are farm workers or coming from a farm worker background, and they were encountering a lot of different cultural norms around, you know, sending your child to kindergarten or other things that I think for a lot of the staff, they were like, what do you mean? Like, why wouldn't you do this? But just different ideas around childcare. And so really making sure that the staff is educated, I think, is another way we can sort of approach potential obstacles and barriers from another side of things.
So from a federal perspective, advocacy, housing provider, we're all about removing silos. And I know you've heard that term, but it's very real. I didn't believe it until I came to work here in DC. As a matter of fact, I said I would never work for a federal agency because they just don't seem to get it. But when I got here, I found out they actually did get it, but they needed people who have boots on the ground. They need to hear from the consumers, from the providers out there to direct that next conversation around how do we remove silos, and when we do remove those silos, what do we do? How do we make our programs work together? And so for the last 7 years, I've been on many interagency councils and coalitions just talking about how we do business versus how they do business. And where do we leave gaps in what we're trying to do to meet the needs of immigrants, of special populations that continually fall through our safety nets that we think are the greatest programs, but we didn't listen to our consumer about some unique needs that don't allow them to be eligible. So that removal of silos is starting to take root, not only in coalitions, but in our funding announcements. So when we release our Choice Neighborhoods funds, we have a Department of Justice influence, Department of Education, and an HHS influence. We're working on the Department of Labor. They're a big animal. They've got some really specific rules, but we're hoping to align how they do business with how we do business so that when we have these mutual customers, immigrants, non-immigrants come through, they can actually benefit from the programs that are offered. I heard Fernando talking about gentrification earlier, you know, that tweaked my ears because that was one of the things I wanted to make sure I wasn't a part of when I came to HUD. Because whenever we do new, we always try to do smaller, greener, more innovative, and so it's starting to not really be family oriented. With Choice Neighborhoods, it's a one-for-one replacement. So if you take down a 3-bedroom, you bring back a 3-bedroom. If you take down a 5-bedroom, you make sure there's resources for a 5-bedroom so that that family's not displaced. Everyone has the right to return to the newly revitalized housing and neighborhood. It may not be in that same block because we're trying to deconcentrate. We're trying to maximize resources in the neighborhood. And so I think that's another thing that's happening for our very diverse population that's coming to us for resources, is that we're not trying to be a one-size-fits-all. Every community has a very unique approach to revitalizing housing, neighborhoods, and people. And so taking into consideration the diversity of the immigrant population. In Seattle, the residents spoke 26 different languages. In LA, we had a Romanian population that everyone didn't know exists, was larger than the Latino population. And so they were all geared around Latino, but in reality, they needed to gear also for the Romanian population because they were equally in the community, but very undercover because of their immigrant status. And so understanding who's in the footprint so that you can then tailor your programs. And one last thing that I'll share that I think has been the most strategic and sustainable approach to changing the language and the conversation is building the capacity of the residents. We have a significant resident leadership training program that is required of all of our grantees so that you teach them what is a housing plan, what's a neighborhood plan, how do decisions get made, where's this money coming from, what does that data mean, what are your priorities, what role can you play in making a difference, and how will you build your capacity so that you can staff it, you can run it, and you can own it. And I think that has been the thing that's starting to change the language for those populations that tend to be in hiding.
Thank you. One of the things that is important also is, before we open for questions, is the things that part of health also is to educate the tenants. Because we focus too much in development housing and other things, but the education of the tenants and how to improve their quality of life, even if they are very low income. They what in example, you know, we confront in the city rat. If you have a cat, the rat is bigger than the cat, and they can run after you. You know, so they should. But how you educate the tenants that what are the indication that you have rats on your apartment? Because sometimes they don't realize, they don't see it, they don't feel it, they don't see it until it's too late. And there's some kind of illness already in the apartment. So things like that is a process. To create a health is not only to look in one side, it's to look at both sides from that perspective. As a developer, we encounter all the times like that. Working with immigrant groups or other ones, in winter, the most difficult things that you confront is to take the trash outside to the trash container, which is far away from you, walk into that distance. So people then just put it at the door. Yeah, they think that's all. But that is impacting an education needed in both sides. Now, we say that, I think it's, the panel did a wonderful job. And I think it's, we are here in keeping on time. I would like to open for questions and see what's, you know, what can we develop all together. Yeah, so hold on a second. Yeah. Yes.
Hi. I work with a community-based organization in Tacoma Park, and I mean the relationship of housing and health has become very clear. We had a building. We work a lot with tenants. We had a building that was being renovated, and some of the tenants got a letter that indicated they were getting a rent increase, and there was made a mistake in it, so it was like a larger rent increase than is actually legally allowed. And the stress levels in the building, everybody just went crazy, and it was also going on while they're doing renovations in the building, and there were some health issues. They had the people there, a huge spike in the number of people going to emergency rooms because of the stress and because of the health and the dust and everything that was going on around them. So, but by way of that, seeing how tenants are in a disadvantaged position, Talia, you talked about how important it was that, I mean, the various options you have under the TOPA. And in Tacoma Park, we also have a right of first refusal. I guess it's very similar. And you said that the co-op option was the most empowering. How often is that employed, and how often is it successful because it is so demanding?
So I don't have necessarily statistics on how often. That maybe Fernando has better statistics on that. And my experience with the buildings that I've worked with might not be representative of what there's other organizers are in the city that do what I do, so they might have different experiences. I find that most tenants out of the ones that I've worked with don't choose co-op. Some definitely do, the majority don't, and I think a lot of it comes down to feeling like they have the time to do that. There might be a couple of tenants that are really excited about it, but tenant associations have to take a vote to decide what they're going to do as a group. And so there might be some people in the building who aren't happy with the decision that's being made, but it's a democracy. Group takes a vote, and whatever the majority wants is what happens. So there's oftentimes a divide between what people are interested in, and a divide in terms of how many people are willing to put in the work to have continued. Sometimes people feel like the meetings that we have just to go through the TOPA process is a lot, and if they feel like that's a lot, then they maybe aren't ready for the co-op option. We also find that buyouts can be attractive to people, and we are not, at least my side of the organization, we're not financial advisors, but I really try to encourage people not to take them if they want to continue renting in DC, because any amount of money that you're giving, it looks like a lot, but if you're going to keep renting, it's going to be gone in maybe 2 years at the longest that it would continue, and some of it's taken away with taxes, so you don't ever get that full amount. So part of it being an organizer is trying to guide people in the direction of what makes the most sense. It's always their choice at the end of the day, but trying to make them really think about what makes the most sense for their families. I do think co-op is the most empowering option, because even when you have a mission-oriented developer that becomes the landlord, who is not going to do these sort of retaliatory practices and is not going to leave you in bad conditions, they still have the final say on everything. So there is significantly more power in being the actual owner of the building and being able to decide what happens. One of the things that we mention to tenants sometimes is, a landlord has a certain amount, there's a limit to how much of an increase they can take in rent-controlled properties. But most landlords will always take that increase, whether they really need that money or not. They'll always take it. And as a co-op, you can kind of say, well, let's look at our budget. Do we need to even take a rent increase this year? Things like that, which is a great option for lower-income folks. So.
Pam, do you have some opinion or?
I wanted to take my HUD hat off for a minute and say I live in a co-op here in DC, and I do see it as a strong resource to folk who are willing to put the time in, but they have to have the capacity to manage that physical asset. And that's not just increasing rent, but also whether there's a plumbing, electrical. Yes, it's more than a notion, and financially, they need to also have some financially managed expertise so they can make good decisions. And that's why we take a lot of time, HUD hat back on, we take a lot of time in our communities to train residents in just that. Don't just pick the color of the door or the walls you want painted. Talk about what's behind the walls. Talk about, what's the life of this flooring you're putting in and these counters, and, what about this washer and dryer? How much is it really going to cost me, and is it going to be sustainable over some 10 to 15 years? Are you going to increase my rent because of it? And so we teach them to really look at the business side as well as the social and the physical environment that they're living in.
Well, from my experience, I can tell you things that co-op is work, but also co-op need a lot of training. You need to constantly educate the tenants, because the tenants, the board has to take the responsibility. It's a business that they have to run. And Tacoma, even if you have the law that it's different in the city, and in the city we are precious to have plenty of support from every administration. Like it or not, they put a lot of money to subsidize affordable housing in the city. There is not enough, but in the city is constantly open to that discussion. In other areas, the administration or the governments are not that open to provide that kind of subsidy that is needed to create an affordable housing. So in that sense, it's a two-way. The government has to participate in it, foundations and banks have to participate in it as well, and the developers or the developers consultant, the organizer have to provide ongoing training. We have in our Casa, we have an ongoing training to the board, the co-op board members. Because every year they change, or every 2 years they change, and they burn out. They have a family to raise, they have all the things, and they burn out. And that's you have a question? Yeah. Sorry, somebody else have a question? Okay,
It's kind of a question of recommendation, if you have any, just to give some context. I was a housing case manager working specifically with people living with HIV/AIDS. And now in my current role, Like you, I work for a membership department for people, or for state health departments working specifically with people living with HIV/AIDS. So a lot of the problems that we came across, and I hear the constant recommendation of education and training of clients, is that clients don't know how to budget. Clients don't have the financial literacy. They don't even know how to possibly understand the leases that they're given. You know, a lot of other, you know, systemic barriers that are in place. So in talking with other health departments and HAPA, well, departments who receive HAPA funding, is there anything programmatic that can be implemented that could, within these community-based organizations, that could help tackle the issues of getting clients to housing readiness? Because that idea of housing readiness is something that we play, at least in my organization, we play around with a lot, just in terms of, you know, you could put clients straight into housing, but if they don't know how to manage that, all the responsibilities that come with housing, they may fall right back out into instability.
Yeah, so I would say, if you're not already familiar, Google permanent supportive housing. So it's a really good middle step between like emergency-based shelters, transitional housing, and then, you know, what we might think of as like regular subsidized housing. So permanent supportive housing, I think it's generally agreed that there is a certain set of the population that will never be fully sustainable on their own. So it could be because of disability, it could be, you know, because of a chronic health issue. I mean, it could be for a variety of reasons. But there are organizations that finance that. If you're not already familiar with CSH, the Corporation for Supportive Housing, they started in New York, but they also have an office in DC. They're a national organization, and they're doing a lot more now with this. So they focus on supportive housing, but they're doing a lot more now with the intersection, so specifically with health and also with financial literacy and child welfare and things like that. So that could be a great resource. But I think that's probably maybe more what some of your clients may need, or some of the work that you're doing. May I also respond?
So remember, I said I worked at a housing authority for 10 years, and I managed the resident services unit, which was family self-sufficiency programs and all the financial literacy programs and housing stability. So whenever we had a resident that had zero income, I mean, no source of cash coming into their household, they were automatically on our radar. If you have no cash, you're going to have problems. Even if your rent is zero, you still have to buy toilet paper, or you still have to buy soap, or you still have to transport yourself to or from. And so what that normally means is you're going to be financially at risk. And so we automatically targeted those households and invited them to what we call a financial literacy program. It's kind of a boot camp, you know, but it was fun, where we helped them to learn how to manage money, but how to get money too, and how to manage their households with food stamps, because non-taxable items, how to clean your house with products like lemon and vinegar and things, baking soda. We did the whole gamut of helping people to manage money, but also how to pay rent, how to be on time. But then once we got them excited, then we started moving them into job training and other economic development programs that would actually build their capacity to earn a small income. Some of these families could not work full time. They had chronic health issues, mental health issues, they had disabled children at home, and so to expect them to go out and get a full-time job was never the reason for that financial literacy program. It was just to help them to sustain and to stay stably housed. And so our program started wherever you were and guided you to wherever you wanted to be with the leveraging of resources. There's a health and human services program called Assets for Independence. Anybody know that? It's an individual development account resource. So if a client earns a little money, they put $1 in, you match it with $3. And so that might be $100 by the end of the month, enough for them to buy toilet paper, soap, and move themselves to and from. And so those kind of programs helped us to change the game for our families who were not high earners and may never be high earners. And there was also a couple of community development corporations. So if you don't have collaborations with CDCs in your community, they tend to also run individual development accounts and financial literacy programs to help people learn how to manage their money. And United Way also runs a series of programs like that at no cost for any resident. They'll come to you, to your public housing community, and run that in your community room, so clients don't have to go anywhere.
Yeah, and I'll just add very quickly, for people who are just in DC, there's also Capital Area Asset Builders, CAB, which does the 3-to-1 matching IDA as well, if you're below a certain income. And then for national organizations, CFED, which I always forget exactly what it stands for, but it's like Corporation for Financial and Economic Development, but they're purely focused on asset building as well.
The lady has a question. We got to our mark at 4:15.
Question.
Yes.
About the choice neighborhood and the ITAC. Is that also in Maryland and Virginia or just DC?
Choice Neighborhood is a national program, but it's competitive. So you have to respond to a notice of funding availability. We tend to release our notices out between March and June, planning and implementation. And a housing authority, a multifamily owner, or a city government, developer, or non-for-profit can pursue those monies.
And LITAC is national as well.
Yes. Well, I want to thank the panel. They were very good. They have a lot of information to share.
I want to thank everyone for being here. Don't move. Fill out your evaluation forms because they're going to be raising the walls. I told you we'd get rid of the walls.
And also, while you're filling out your evaluation forms, I just want to make a quick plug. We're going to, in the next couple weeks, be launching a new website, which may be a good resource for some of you. So half of it will be a resource repository, highly searchable by topics and populations, research briefs, policy briefs, news articles, infographics, webinars, podcasts. The other half of it is really collaborative. You can join different communities. You can mark yourself as an expert. You can connect with other people on a whole variety of topics, including a whole host of things that we talked about today. So if you're interested in getting an email when that site goes live, feel free to sign up.
Thank you.
Thank you.